More cuts on the way for the Department of Health and Human Services. NBC News has learned about plans to wipe out more than 100 federal advisory committees. Now, these committees provide a place for medical experts and scientists to advise HHS on health policy and cover topics from cancer research to maternal mortality. Let's discuss with pulmonologist and MSNBC medical contributor Dr. Vin Gupta. Doctor, we're learning these cuts could include groups that focus on infant and maternal mortality, organ transplants, blood products, sickle cell disease, and cancer research, among others. These are all really serious, important issues, but what exactly do these committees do?
Well, Anna, good morning. You know what these committees do is they serve as a function of vital expertise that, frankly, the government doesn't have internally in many cases. These are really complicated topics, take many, many years to develop expertise in, which is why it's really smart when we think about governmental efficiency to have a group of advisors that are not on their full-time books, they don't have to pay benefits for, but are there at the service of the government to provide critical expertise, sickle cell disease, organ transplantation, blood donations. The science behind those various categories changes just fundamentally over time. And so having people that understand those spaces but are not on the full-time roles makes a lot of sense.
So what happens then if these advisory committees go away?
Well, put simply, they lose vital expertise. And then now you're talking about generalists that don't know and don't have the breadth of expertise to be guiding key policy decisions, say that the CDC is thinking about when it comes to preparedness and response, or when HHS is thinking about updating guidance when it comes to organ transplantation, which is a fluid part of the medical system. We're learning as we're going. So if you don't have the right experts, your policy is going to suffer, and it's not going to be nearly as evidence-based as it could be.
In the meantime, the number of measles cases keeps going up. We now have almost 400 confirmed measles cases in the U.S., mostly in Texas and New Mexico. That's really concerning, as this seems to be multiplying almost exponentially. What actions do health officials need to take now before it gets even worse?
Well, there's interesting signs, Anna. I mean, this is sort of a small consolation that New Mexico Department of Health and Human Services out there said that vaccinations actually have doubled in the first part of February relative to the same time last year. So some of that messaging is really getting through that that's really the only thing we can do. If you're pregnant, unvaccinated, and exposed, you might qualify for a treatment called immunoglobulin. So be armed with the latest information, trusted information. I will say, Anna, just as a point of personal privilege, I am helping to organize later today at 5:30 p.m. Eastern a digital webinar with the American Academy of Pediatrics, the American Federation of Teachers. We're trying, civil society, to help fill the gap. I'll share more on social and tag you. But really, this is the Wild West when it comes to information, and there's still a lot of misinformation out there.
Well, thank you so much for being a voice of expertise for all of us and for offering yourself up to the masses through a webinar like this. And I'll definitely make sure to spread the information as well on social media. Again, thank you for joining us for the conversation. And along the East Coast,